Hello, Dr. Chrysopoulo. Can you hear me okay? Seems like I'm going to exit out of the broadcast and maybe he'll come back in. Dr. Chrysopoulo, you there? Hi, everyone. I have Dr. Chrysopoulo on from president of PRMA. I'm adding him in. There was a little bit of technical difficulty. I think they're fixed. Dr. Chrysopoulo, are you still there?
I am. Hello. How are you?
Thanks. Great. Thanks for coming back on. For everyone watching, and then this will actually play out on social media, Dr. Chrysopoulo is this amazing surgeon I've known for about 3 years, president of PRMA, founder of the Breast Advocate app we'll talk about today. But he just does so much for women. And I actually talked to his team this morning. His team, Courtney, does a lot of work out there with PRMA to help women get the word out on breast reconstruction. So thank you for being here. A little bit of technical glitches because so many people are on these platforms these days. How are you, Dr. Chrysopoulo?
I'm great, Christine. Thanks for connecting again. No complaints on this end. Everyone's doing fine. Good, are you staying sane?
I would say partly. I've been inside with a 5-year-old for about 6 weeks, and I probably have mask lines because I actually went out to Walmart today, and I got so excited to be in Walmart, I had to rush back home. But yeah, as you have kids too, you know how it's been challenging.
Yeah, for sure. Interesting times.
Yeah, and my understanding in San Antonio, the different surgery centers, I know you have your own surgery center, but there's a lot of confusion on can they reopen? I know we'll get into the Breast Advocate, but I talked to the mayor of Chavano this morning, Mayor Bob Warner, and it seems that the governor's feedback on opening is a little different than our local mayor, Nuremberg. So I think there's a lot of doctors confused, patients confused. I don't know your take on that.
Yeah, definitely lots of confusion, especially as it relates to hospital setting and ASCs, surgery centers, which obviously a lot of plastic surgeons operate either out of their offices. They have operative suites, many of them, and others have surgery centers or ambulatory surgical centers. So yeah, there's been a lot of mixed messaging and some confusion for sure. For us at PRMA, we're back. We're operating again.
Oh, good.
Yeah. That's I'm very happy with the procedures in place at the hospitals in terms of testing. I'm one of those who believes that we need testing for all preoperative patients.
Yes.
Personally, I wouldn't be comfortable offering surgery to people right now in my practice for what we do without preoperative PCR testing. But
that's great.
Yeah, pros and cons to every approach, but that's just my take.
And also it's to protect you too, Dr. Chrysopoulo. We talked to Dr. Michael Zen yesterday. You may know him out of North Carolina.
Mm-hmm. Yeah, how's he doing?
He's great. And you know what he said? Because he's been in practice for over 30 years. He said he's treating this like when AIDS came out, every person you just pretend has AIDS, and the same with COVID. And then that way you have universal precautions. I thought that was nice.
Yeah, well, that's definitely a way to go about things, especially to maximize the safety of your own team. So for sure, good practices. You have to have consistent, good, safe practices for everyone and protocols, and for sure, for us specifically, our fears are operating on asymptomatic positive patients.
Right,
someone who's positive, who doesn't know it because they're not showing any symptoms. So there's some data out there. Some of it's not great data. The level of science, the quality of the data isn't always the best. But whenever there's data that suggests that positive patients who are asymptomatic are at higher risk of developing postoperative complications, you've got to take that data seriously.
Yeah, they haven't formed the antibodies. Is that correct? If they're
No,
asymptomatic?
what I'm talking about is, so there was a study out of China that looked at elective patients having surgery, various specialties, not just breast reconstruction, but they looked at patients who were actually, in retrospect, positive for COVID, but at the time hadn't shown any symptoms. So
Yeah, right.
they would have passed all verbal screening measures. But many of those patients ended up getting complications afterwards that otherwise you wouldn't have expected them to have. So there was a very high rate of pneumonia and
mortality, probably, right?
The mortality was actually 20%. So you can rip that study apart from a scientific, in terms of scientific vigor.
But it has trends in it, even if it's not statistically.
You got to look at that, and so there's lots of other data you have to take into account. What's the risk of someone being an asymptomatic carrier? What's the rate of infection in the community? In San Antonio, only 10% of people being tested for COVID are coming back positive. But without mass testing, you don't know what the baseline rate of infection is.
Right. So, that's what Dr. Fauci talks a lot about, that statistical.
So anyway, there is a school of thought that's a lot more, it's less restrictive. So there is a school of thought that if you have a low-risk patient who hasn't had any obvious exposure, who passes all the verbal screening and physical screening, so no symptoms, normal temperature, normal oxygen saturation, just on a pulse ox,
Yep.
Then you don't need testing on that person. So that's definitely a track that some surgeons are pursuing, So, and there's definitely some value and argument to pursue that line and to reserve testing, PCR testing, for only the high-risk group.
Right.
So that's certainly an approach that many surgeons will be using that's accepted in terms of being safe. So I don't want people to come away from what we're talking about here and think that what I'm saying is that if your surgeon doesn't test you preoperatively, then you shouldn't be having the surgery. That's not what I'm saying. You have to take into account your individual situation, the geographic location, what's going on, what's the landscape where you are, and just have a very honest conversation with your surgeon and talk about the protocol, right? So there's no one way to approach this.
I think that's thank you, Dr. C. And I know I sort of hijacked this. We're going to talk about Press Advocate because I really want to talk about that. But the news is so fast and curious. Topics come up. And I have one question from the audience for you, and it's: do you have the proper PPE that you need for your surgery center? I guess one of our people watching.
We do.
Okay, great. I think that answers it.
Yeah,
great.
We wouldn't be doing it. We wouldn't be doing elective cases if we didn't.
I thought that was the answer.
And you also have to. That's part of the protocol too, right? So we used to, pre-COVID. The scrub techs would open up a set number of gowns and set number of gloves, and we all have in some of the long cases we do. Sometimes we use 2 gowns, so even that's changed now. So any gowns. So number one, we're not opening gowns that we don't know for sure that we'll need, and then in the event that there's a gown that isn't used, that's now repurposed, and now that's collected and sent to another part of the hospital where they could use that in a non-sterile setting, right? So
excellent. This is really changing the resources and protocols.
Yeah,
you
have to. I mean,
Yeah.
you can moan about it and all the rest of it, or you can get on with it, right? So.
Get on with it. Well, getting on with it, that was perfect, because now I'm going to get on and talk about Breast Advocate. And I've been following your Breast Advocate. I think it's been out. Maybe tell us a little bit about how you thought of doing it. I think it's been out 2 years. And
getting close. So it launched the first version was October 2018. We're on version 2 now. And, you get to the point in your career where, you feel good about what you're doing and you're helping a bunch of patients. And, in terms of breast reconstruction, I was touching about 200-300 women a year. But what occurred to me after hearing the same thing for many years from many patients, that it was a recurring theme of, if I had known this then, I would have chosen differently, or I would have wanted something else. Why didn't I know about this? Why didn't they tell me? Why wasn't this offered to me? And so then I was at a point in my career where I was happy with what I had achieved personally. I don't have anything left to prove to myself or anyone else. So I thought, what can I do? So instead of touching 300 women, I can potentially touch more of the 300,000 that are diagnosed with breast cancer every year. So really, the shared decision-making approach is something that I've built my career on, involving the patient in the decision-making. And this goes beyond just discussing the risks and the complications. I mean, really finding out what's important to the patient, what are their preferences, what's going on in their life, what's their support structure, what do they want in terms of an outcome, what are their values. Basically incorporating anything into the decision-making that's important to that person. And so then you end up using a shared decision-making process to come up with a treatment plan. So the patient brings their preferences, their values, their situation, and then the surgeon brings their expertise and evidence-based medicine, and you combine all those factors to come up with a treatment plan. And so you could have a patient who's got, you could have identical twins with identical diagnoses, identical body habitus, and you could have 2 completely different treatment plans. In terms of breast reconstruction.
One's an avid skier or into working out. She may want to keep her abdominal muscles, right? We've had that happen.
Yeah, exactly. So the whole point is that it shouldn't be like, even on social media, it's interesting. You've got a lot of advocacy, patient advocacy, which I love. It's fantastic. So you are your own best advocate, right? But what's interesting on social media is that it's also very tribal. And so everyone's got their little thing that they're advocating for. But then sometimes that comes across as, if someone else is advocating for something different, then they're wrong.
Right.
You know what I mean?
Not true.
And that's not the case. It's so human beings are very tribal by nature, but it shouldn't be that one agenda trumps another. So there is no right. There's no one right thing. So in terms of breast reconstruction, we need to get beyond this argument of, tissue is better, implants are better, or this is better. It just depends on the individual, what they want and what the situation is. And so,
and some may not want anything, right?
Exactly, right. And so it shouldn't be, well, if you choose breast conservation, you're wrong, or if you choose to go flat, you're wrong. And I know no one comes out and says that, but sometimes that's the feeling, and that's the tone. And you see this irrespective of what someone is advocating for. There are examples of this across the board. So I want to get beyond that, and I want it to be about the choice and the person's preference as that is the core one factor that we've got to break this down to. right? So I get invites to interviews frequently, and especially from advocacy groups. And there's always that first question of, how can we advocate for this more? And then instead of going through the same process for each thing, breast reconstruction, deep flaps, oncoplastic surgery, going flat, nipple sparing, instead of going through the same thing for every single option, how about we just advocate for shared decision making so that patient gets what they feel is best for them?
I think that's. I can tell you.
Then we can all combine our efforts, right? And everybody wins. And it's a
there's
cliche.
no agenda, but
there's
the
no
patient's
agenda.
That's what should be. Yeah.
Right. So that's what the app is about. So that's a very long-winded answer about Breast Advocate.
No, we're going to put the app on our site. I just said it's on. You can download it in the App Store, right, Doctor?
Yeah, you can add, App Store, it's Breast Advocate. Go to the App Store, Google Play. It's available for iPhone.
I have it on my phone.
iPad, Android. And you can also, if you want to learn more about it before downloading it, you can go to breastadvocateapp.com. And it's for everyone that we've touched on in terms of demographic. It's whether you've just been diagnosed with breast cancer or just been diagnosed with a gene mutation, whether you're a woman, whether you're a man, because men get breast cancer too. It's not a breast reconstruction app solely. It covers lumpectomy, oncoplastic surgery, mastectomy, prophylactic surgery, going flat. It covers anything that you really want to consider. It's got a bunch of resources, a community feature. We've got our unique value kind of function is the wizard function, which basically asks you a bunch of questions.
Here it is for anyone looking to download it. Yeah,
there you go. The wizard asks the user a bunch of questions. We don't store any of your answers. We're not collecting anyone's data. I don't want to get into the whole,
HIPAA, yeah.
Your data is your data. I have no business owning it, so I'm not interested. No one's going to collect and sell your data. The only thing we track is user analytics. So what that means is we track how many times users access a certain article or a certain wizard. I can't identify who accesses it.
And that's normal for having been in the industry, Dr. Chrysopoulo. Anytime you have a website or anything, you do that because it helps you give more value to the patient.
It's basically Google Analytics. There are various different analytic platforms that people use, but that's just one example. But it's user analytics that are completely anonymous. It's just numbers. It's it doesn't collect anything that's identifiable. But anyway, so the wizards go through and it asks you a series of questions, and then it combines your preferences with evidence-based medicine to give you a recommendation.
It's almost an algorithm for shared decision making.
That's exactly right.
I ski or I swim, and I don't want, I want to be able to do sit-ups or something.
Yeah, I mean, it's not that specific, but that sort of thing. It basically, some women, their nipple sensation is the be-all and end-all. Mm-hmm. Others couldn't care less because they haven't had nipple sensation in forever, and for them it doesn't mean anything. So who's right, who's wrong, it doesn't matter. It's personal preference, and that's the whole point. Now, the other thing about the wizards and the app in general is that this isn't to replace your physician or your team. This is to give you the knowledge and the ability to have the conversation that you want to have with your team. So we have a bunch of different experts in there, different plastic surgeons, different breast surgeons. I'm in the middle of adding some content provided by Dr. Lang, who is an excellent medical oncologist.
Oh, good. I didn't know
yeah.
that name. Dr. Lang.
Yeah,
Okay, great.
yeah, she's phenomenal. So I'm just actually just yesterday I uploaded some content to do with chemotherapy and targeted therapy. So we're forever adding content. So really, it's going very, very well. It's free for patients. It's always going to be free for patients. We get our sponsorship money from industry, which is very important to help us kind of keep it going and keep it updated. Right now, for example, we're also updating the wizards with the latest evidence-based info. So a couple of the wizards are actually being updated right now, so they're not available, but they'll be back online very soon. But it takes upkeep. It's a labor of love, but we're getting some rave reviews. You know all about labors of love. Yeah, that's why you're smiling.
I'm laughing, but I'm also laughing because I recently left the company I was working for. So I got a new phone and I was like, where's my breast advocate? So I just downloaded it again. I was like, because I knew I had it.
Yeah.
Yeah, but I know you're the tech savvy, not that your partners aren't, but I know you love the technology and you teach me a lot about apps. But I really encourage everyone watching, and this video is going to go live on several channels, just to really think about downloading this breast advocate app. And I think what we'll do, Dr. C, is just start really pushing it out there. We just finished our donate a photo yesterday that J&J provided to us. So now that's off our shelf, and now we need something else to talk about. So perfect timing.
Yeah, that's great. That's great.
I'm glad you're back to operating.
Yeah, no, me too.
I don't know if your wife and kids are, but we're glad you're back there.
I don't know if they're glad to have me at the house or not.
We'll interview her next time.
I don't want to know.
Next time we'll interview your wife. But we're at 21 minutes. Thank you so very much, and we'll send this out. You're always so amazing.
Thank you. Thanks for everything you're doing, Christine.
It's fun.